My name is Kary, and on June 12, 2011, I died. I think the biggest myth that people might have about heart attacks is that it won't happen to me. It can happen to anybody. Yeah, I'm a bigger guy, but my cholesterol was fine. I'm not diabetic. There's no heart disease in my family. Nothing. It happened to me. I was on a couch in my parents' house. I had an incredible pain in my chest. I've never had a pain that great. It was immense, and I knew something bad was happening. So I immediately looked at my father and told him, "You need to call an ambulance."
I didn't know what was going on, but I could hear him say, my heart, I'm having a heart attack.
It made me collapse to the ground, and I tried fighting it. I stood up, I went down, I stood up, I went down. I kind of knew what was happening, but I wasn't sure. By the time that I recovered, probably from the second or third time, the ambulance was already there. They got me in the gurney, they got me to the ambulance. All I remember was the pain. The pain was incredible.
I don't know what made me decide to go with the ambulance. I said, I'm riding in the front seat.
Probably about halfway to the hospital, I blacked out, I guess.
And you don't like to hear, if we don't hurry up, we're gonna lose him again. And maybe he won't make it.
The next thing I know, I'm in the emergency room at Excela, and there's this nurse.
He was able to survive the cardiac event. He woke up. I said, "Welcome back, Kary."
Not knowing from where or why, but I thus then realized that I was dead, and she had indicated that I had died twice. So as they're rushing me to the cath lab, Dr. Grill was talking to me and my family.
He, of course, was having pretty severe chest pain and had just been resuscitated from a cardiac arrest in the emergency room. We went ahead and planned to do a catheterization to see what was the artery causing the heart attack.
What I needed was a stent that had 100% blockage of my LAD artery, and this had to happen now. There was no time for anything.
As soon as we had restored normal flow, Mr. Yerkeson had very significant improvement in his symptoms and really started feeling a lot better.
The pain was gone, and it was a relief. It was like a day off, after working a 72-hour shift. Then the next thing really that I do remember is being in the CCU. There were family, friends all around me. My team was there. My wife, my kids, my parents. Little things don't matter. It's the people you love, the people you run into, and the people that support you. Come first now. It was a pleasurable stay, being that I was actually alive to see it. And on the final day when I was ready to leave, they brought up the escort and the wheelchair, and they're like, "It's time for you to go. Congratulations." I wanted to walk out. That was my goal, was to walk out of that hospital. I came in on a gurney, I wanted to walk out, and I did walk out. The team up there, Dr. Grill and his associates, they're lifesavers, and they saved my life. That's big, at least in my eyes. My name is Kary, and on June 12, 2011, Excela Health saved my life.